All right. Welcome. Thank you for being here. Thank you for joining us. My name is Damaso Reyes. I'm a consultant with Penn America, and I am going to be leading our session today, which is being done in partnership with the National Council of American Indians. And I want to welcome and have Dr. Aaron Payment make a quick hello as well.
Good afternoon. Can you hear me? Ani buju biwaka jigandishnakas makwa magizi and doram bawating and donjaba anishinaabe ojibwe odawa otawatami and dao. I'm Aaron Payment, Dr. Payment, and I am chairperson of my tribe, the Sault Ste. Marie Tribe of Chippewa Indians. We're the largest tribe east of the Mississippi with 46,000 tribal citizens. I also serve as the secretary for the National Congress of American Indians, and I serve on several tribal advisories, but a couple related ones are the HHS Secretary Tribal Advisory and also the National Institutes of Health Tribal Advisory. And so our people are very important to us, our elders are very important to us, and so I hope I can shed some light on the pandemic in Indian country and vaccinations and importance of and all of that, and take questions when we get to that part. Thank you.
Thank you very much, Dr. Payment. We just want to introduce our discussion roadmap. We're going to hear from my colleague Hannah in a few moments, who's going to talk to us about Penn America's programming and their work on media literacy. Then I'm going to walk us through the sources of misinformation and news that we encounter in our everyday lives. We're also going to talk about mis and disinformation and how we come across that in our everyday lives too. And we're also going to explore a couple of techniques that we can use in our everyday lives to detect misinformation and verify information that we come across, especially on social media. And then we are going to end with a discussion and a question and answer session with Dr. Siobhan Westcott and Dr. Payment. And you will have an opportunity to ask these leaders of the Native American community questions. We have a tribal leader, we have a medical doctor. So if you have any lingering questions, if you have any concerns that you want to raise, this is a wonderful opportunity, as well as obviously you can ask questions about anything that we will have covered in the preceding 45 minutes or so. So with that, I'm going to actually hand it over briefly to my colleague, Hannah Waltz, who's going to talk a little bit about Penn America and what it does.
Hi, everyone. My name is Hannah Waltz, and I am the U.S. Free Expression Programs Coordinator here at Penn America, tuning in from Brooklyn, the ancestral and unceded territory of the Lenape people. Firstly, I want to just say that we are so grateful to our partners at the National Congress of American Indians for bringing this program to life with us. Bernita, Jansen, Yana, thank you so much for all of your support. And thank you to our sponsors at the Native American Journalists Association. Before we begin the workshop, we wanted to provide just a quick overview of Penn America and why we're here with you now. Penn America stands at the intersection of literature and human rights to protect free expression in the United States and worldwide. We champion the freedom to write, recognizing the power of the word to transform the world, and celebrating creative expression and defending liberties that make it possible. Damaso and I work on our media literacy programming and research as part of our larger US free expression portfolio, working to equip the public with skills to access accurate information and stop disinformation in its tracks. Penn has long monitored the harmful effects of disinformation as it poses a significant threat to free expression and civic dialogue, and published 2 landmark reports on the way fraudulent news and online disinformation distort public discourse, erode faith in journalism, and skew voting decisions. Our report, Faking News, examines how fraudulent news is eroding truth-based civic discourse and constitutes a threat to free expression. And Truth on the Ballot, our report, which builds on the former, warned that domestic actors are increasingly experimenting with fraudulent news and information as a political tactic, sounding the alarm that these unsavory methods were becoming part of the toolbox of modern campaigns. Thankfully, we can now turn to media literacy as a proactive response to these threats that mis and disinformation pose. At the beginning of 2020, we launched our media literacy program, Knowing the News, with a series of public workshops that addressed disinformation about the pandemic, protests, elections, and more. And this year, we've taken a bit of a step back to look at the broader picture that disinformants seek to deepen division, preserving social and societal inequities, so different communities are targeted more aggressively than others. We saw this with both vaccine and election disinformation, which sought to disenfranchise voters of color. This context is important as we seek to better understand the contours of this issue. I will be dropping some links in the chat if you're interested in learning more. And in the meantime, I'll hand it over back to Damaso. Thank you.
Thank you very much, Hannah. And to get things started, we are actually going to ask you if you are willing and able to fill out a short survey. This survey is designed to help us learn more about how you understand information and process information, and to help us be able to measure the impact that we have, hopefully at the end of the session. The survey is actually in two parts. We're going to do one part now, and you can follow the link on the screen or copy and paste the link from the chat. And then there's a second part that we're going to do after we do our training here. And the great thing is after you hopefully fill out the second survey, there's actually going to be a chance to enter a drawing to win one of 5 $100 gift cards. So it's an opportunity to help us learn more about you. And by the way, the surveys are totally anonymous. You'll be able to win a little bit of a reward too. So with that, we're going to pause for just a few minutes, 3 or 4 minutes, while hopefully you take a moment to fill out the survey, and then we're going to dive right into our presentation. So we're going to put on a little bit of music while we wait, and then we're going to see you in about 2 or 3 minutes.
Sweet a little honeybee, baby, been sweet on me. Sweet a little honeybee, my queen bee. Rock me to my soul, love me to my soul, my baby, 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 to my soul. Rock me to my soul. Honey in your honey pie, the body is hot. Honey in your honey pie, on the pot is what you got to love, ooh, my soul. Rock me to my soul, my baby, 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 to my soul. Rock me to my soul. Watching that, look at her around. Strutting and shaking some. Dancing, having fun. Ooh, love me to my soul. Rock me to my soul, my baby, baby, to my soul. Rock me to my soul. you come by me? Spare me of the misery. Sugar, won't you come by me? Oh, I know you're agree. Love me to my soul. Love me to my soul, my baby.
All right, we are going to head back. Hopefully you've had an opportunity to access the survey. If you are still doing the survey, feel free to keep on doing that and finishing as we begin our presentation. That's perfectly fine. But we're going to dive right in because we have a lot of information, hopefully to convey that is helpful and useful to you and your community. So one of the things that's really important for us to recognize is that the way we gather and the way we engage with information has really changed, certainly over my lifetime. And I'm not that old, but for some of us who are maybe even a little bit older than I am, it's changed pretty dramatically. And one of the things that is really important for us to acknowledge is that if we are primarily getting our information from social media, from the internet, then we're likely to be exposed to a lot of information which is not of a high quality. Especially when we're on social media, whether it be Facebook or Instagram, if we're using a messaging app like WhatsApp, we're coming across a lot of information which has not been vetted. We don't necessarily always know what the source of that information is. And as we see from this research from the Pew Center, is the conspiracy theory that the pandemic was intentionally planned. So this is something I think that's really important for us to acknowledge and to be aware of as we are on social media and surfing the internet. And it's important for us to think about where we get our information online. Some of us are like myself. My background is as a journalist. I get a lot of my information from news sources, from sources like the New York Times or the Washington Post or the Associated Press. Some people in this audience probably still get newspapers delivered to their homes. One of those small percentage of people who still do. A lot of people are reading op-eds or opinion-based information. We also see social media, radio programs, and private messaging apps as well. So it's a really big landscape of information, a lot more so than when I was a young boy growing up in Brooklyn. If I wanted to read a foreign newspaper, I would have to take a train and go to a big library. So it's really important for us to realize is that we're being exposed to much, much more information than we were, say, 10, 20, or even 30 years ago. And it's important for us, of course, to talk about disinformation and misinformation. These are probably terms that you might have heard, but I think it's always important for us to define our terms. So when we talk about disinformation, we're talking about false information which is deliberately spread. And often the people who create and spread this information are trying to cover their tracks. They're not being honest about who's creating it and why they're creating it. Another thing that we like to talk about is misinformation. So misinformation is the broader term which looks at all sort of false information. So it's helpful for us to define these terms because we're going to be talking about them a lot. And let's keep going. So one thing that we notice is there are a lot of different types of disinformation. They have different motivations. So everything from fabricated content, so that's something that is totally made up, to something like satire, something that's perceived as a joke, or something that people aren't sure that it is false, right? It's if I know that if I read a headline in the Onion, I know that that's something that's supposed to be a joke. But unfortunately, what we see often is satire moves around the internet and not everyone knows that it's a joke. So then it becomes a kind of misinformation. And then sometimes there are people who hide behind this idea of false information or satire, and then they call it satire. So they create disinformation, but they actually call it satire, even though it's disinformation. This is just something for us to be aware of and to think about a little bit. So one of the things that is really important for us to understand is kind of the life cycle of misinformation. Oftentimes, we'll see a piece of mis or disinformation, it is created. But what's really important for us to recognize is that misinformation doesn't spread without us helping it. So when we talk about something going viral, we essentially are the vector for that misinformation. We're the ones who are spreading it. And so if I share something that's false, people in my community see me sharing it and they trust me, so they might believe it, or they might share it because they consider me a trusted source of information. So that's another important thing for us to recognize, is that we're all important, trusted sources in our community. So we actually have an obligation to really try to make sure that that the information we're sharing is accurate. Now, what we're also seeing, unfortunately, is some of our leaders, whether they be people we admire because they're great artists, or maybe they're political leaders, are sometimes sharing information which isn't accurate. So this was a message shared by a musician, Nicki Minaj, a few weeks ago that went viral. And she was trying to explain her reason for not getting vaccinated. But unfortunately, this piece and it turned out that it wasn't accurate, it wasn't true, but it went viral because she has lots of followers on social media, and those people shared it. Now, the people who shared it, they didn't know necessarily whether or not it was true, but they were sharing it because she was sharing it. So we often see this, whether it's on a small level, whether it's a friend or a family member, or someone who's a respected member of our community who shares something. And because we admire that person, or we respect that person, we trust that person, we transfer the trust that we have for that person onto the information that they're sharing. And that's an important thing for us to recognize. Just because someone is verified on Twitter or Facebook or another social media platform, just because they hold a position of authority or a position of respect. Someone could be a great athlete, someone could be a great musician. Doesn't mean they're a medical expert. So if they're sharing their opinion or their thoughts on something like a vaccine, do they have the facts? Are they expert in that? And the answer, of course, with Nicki Minaj is, in this case, no. This was pretty thoroughly debunked. Here we have an example of a message that was shared on social media. And as you can see, this particular message was shared in Spanish, but a similar message was actually shared in English. So something we see a lot is social media, or misinformation on social media, is actually being shared in multiple languages. It's being targeted to multiple different communities. Maybe they change a small part of it, but this image of a woman, of a nurse holding, or a doctor holding a sonogram and getting vaccinated, and then the text around it claims that shortly after this, this person then had a miscarriage. And obviously there have been a lot of concerns around the vaccine, around COVID and fertility. This message, or this piece of information, is actually a piece of disinformation. It's false. The woman in the picture actually had a healthy child. But one of the things that's really important for us to recognize is that just by looking at this, it's impossible to actually tell whether or not this is true or whether or not this is false. We don't have enough information to tell whether or not the text that's next to the photo, is this person? We don't know. It might be, but it also could be somebody who's trying to be an imposter, who's trying to create this information, this piece of misinformation in order to frighten us. So we're going to explore a little bit later some techniques we can use to actually try to verify the information that we come across on social media, because sometimes it's not enough just for us to look at something to be able to tell whether or not it's true. So when we think about disinformation, we think about misinformation, it's really important for us to recognize the reasons why we're actually susceptible to it. People who create disinformation, they often play on our emotions. They want to trigger emotions in us. So that could be fear for ourselves. It could be fear for members of our community and concern for our community. It could be anger. So if you find yourself having a strong emotional reaction to something you see on social media, that might be a red flag that this is actually engineered to try to trigger your emotions. And when our emotions are triggered, often our ability to reason is suppressed. So the people who create this disinformation, they actually want us to be angry. They want us to be frightened. They want us to be concerned, because then we won't ask questions like, where is this coming from? How do I know this is true? And what we do when our emotions are triggered, we just react. And the way that we often react is by sharing the thing that concerns us to let other people know about it. And that's exactly what people who create disinformation are hoping for. They're hoping that we're not going to ask questions, that we're just going to share what we've seen. Oftentimes there is a patina of credibility. So as we saw in the previous example, someone claimed to be a doctor. Often we see that people are impersonating medical officials or elected leaders or members of our community. We've seen that a lot with the Black Lives Matter struggle. People who are claiming to be members of the African American community or members of Black Lives Matter being impersonated on social media in order to give them some credibility. Something we also see a lot of is what we call the illusory truth effect, which is very simply, the more you see something, the more likely you are to believe it. So if you see something going viral on social media, if you see lots of your friends or people you respect on social media sharing something, you're likely to believe it, whether or not it's actually true. And finally, a really important tactic that people who create disinformation use is something we call confirmation bias. And this is a natural tendency that we all have to believe information which confirms what we already believe. And the opposite is also true. We're more likely to reject information which challenges our belief. And the people who create disinformation, they know this. And they create disinformation, which is targeting our communities. It could be targeting our ethnic or social groups. It could be targeting our political groups. It could be targeting our geography, where we live, our hobbies, the sports teams that we happen to support. All these are things and techniques that people who create disinformation use. So it's really important for us to recognize that this exists. And these are ways in which we're targeting. So one of the things that we want to talk about is how to talk about misinformation with the people who share it, right? I'm pretty sure we've all come across someone on our social media feed, or even maybe just in conversations in our everyday lives, who are sharing something that's not true. But how do we engage with these people? This is often a very delicate and challenging thing to do. So the first thing is, obviously, we definitely want to verify that the information is actually not true and not accurate, right? So we want to do our own research. We want to make sure that we actually have the facts on our side. If we're on social media, there's often a question of whether or not we should make a comment. If we're on Facebook, do we drop a comment in that post? Or something that I've found is actually really helpful. Sometimes I message the person directly and I say, hey, you might not be aware of this, but I think that the post that you shared is inaccurate, or it's a piece of misinformation. Here's a link to a fact check, or here's a link to another authoritative site which disproves what you shared. And what I found is a lot of times, most of the times, people who are sharing misinformation on social media don't realize they're sharing it. And they actually thank me, or they say, oh, wow, I didn't know that. And then they take the post down. Um, in all cases, we obviously want to avoid escalation. One of the odd things that psychologists have proven is that when we are confronted with someone who is aggressively trying to correct us, everyone is more likely to hunker down in their positions rather than trying to understand why they might be wrong. So it's really important to avoid escalation. And as always, we want you to be a resource for other people in your community. Become the person that people turn to when they have a question about something that they see on social media or a piece of information that they're not 100% sure of. And then you can help guide them through the process of checking that information and asking the important questions in order to figure out whether or not something is accurate. So one of the things that's really a healthy distribution of information. One of the things that we often see is that folks are getting information from one or two sources, whether that be Facebook or whether that be a particular cable television news channel. So it's really important to kind of diversify the sources of information you come across. As we said earlier, make sure you think about how you're reacting to something. Even if you don't share or reshare a piece of misinformation, if you just interact with it, if you like it, if you comment on it, the algorithm sees that and decides that, okay, we should expose this information to more people since a lot of people are engaging with it. So that's something to keep in mind as well. Sometimes it seems kind of obvious, but sometimes we actually do need to ask ourselves, is the thing that we're looking at as a piece of information, we're looking at news or opinion? Sometimes there's a lot of great and important and useful information in opinion-based arguments, but opinions are designed to try to persuade us. And sometimes people who make opinion-based arguments leave out important information. News, in theory, if it's standards-based, is trying to inform us. It's not necessarily trying to convert us or convince us of something. It's trying to tell us how the world actually is. So that's an important thing to realize. And oftentimes opinion-based arguments are very persuasive because they're appealing to our emotions. So this is another thing to think about and to keep in the back of your head when you're coming across information. When we talk about news, these are some of the things that we are looking at. We are asking ourselves whether or not we have high quality information, whether this information is accurate, whether it is standards-based, whether it identifies its sources, whether fact checks are involved, whether it's thorough. Oftentimes when we're coming across information which is not standards-based, we are encountering information that is trying to manipulate us. It doesn't have these hallmarks of credible journalism. So this is, oftentimes we talk about what news is and what news isn't, but I think it's incredibly important for us to define those terms and to better understand what we're actually looking for. So we're gonna talk a little bit more about how do we do this? How do we do this a little bit more in depth? Checking the credibility of the sources we encounter. Just because something has news in the title doesn't mean that it's actually a news site. There are a lot of sites that are created sometimes by political parties, sometimes by people who have a particular point of view that they're trying to promulgate, and it looks a lot like a news site, but we won't necessarily see a byline. We won't see other hallmarks of that quality journalism, as we just mentioned. And obviously, we want to do things like fact checking. And we'll talk a little bit more about how to do that. We will talk about how to do something we call lateral reading, but even sometimes just doing a quick search on Google, we can come across information which will help us understand whether or not something is true or false. One of the things we're going to do right now is we're going to actually do a kind of a hands-on, quick live search and live test of some of these ideas and some of these concepts. But the first thing that we can do, especially when we're looking at images, is to actually use our eyes. This is what we call observation, right? We're looking closely at the image. We're looking at who's sharing it. Is the person who shared this image the person who created this image or took this image, or are they sharing it from another source? Sometimes that's a really important thing to understand. Trying to understand whether or not this is a recent image or an older image. And then finally do something we call a reverse image search. And so we're actually going to do that right now. We're going to try this out. So here's an image that went around on social media last year during the height of the pandemic. And remember we talked about confirmation bias? Well, you know, this woman is wearing an American flag. She's holding a poster up. Maybe she looks like someone who we might think might believe in conspiracy theories for one reason or another. And again, people who create misinformation are actually creating images in order to tap into those hidden biases that we all have. So we are actually going to, right now, go into, right now I'm using my Google Chrome browser. So if you're on a desktop, you can do something really simple. So your mouse has two buttons, a left button and a right button. If we do something that we call right click, we use that right button instead of that left button, we get this whole menu of options. And one of them, we can save the image, we can copy the image, but we can also search Google for the image. So I'm going to select that option. And when I do that, I get a Google search. And so just like we can search Google for phrases and for words, we can actually search Google for image. And Google will then look all over the internet and try to find other images that look like this image. So one of the things that's really important for us to do is to not necessarily click on the very first thing we see, but to actually take a little bit of time and to look at other search results. So one of the things we'll see other versions of this here, but when we scroll down just a little bit, here's the fourth result. We actually have a link from the Washington Post. So by not clicking the very first thing, we might actually find a higher quality source of information. This is something we call click restraint. So it's actually restraining yourself from clicking the first thing, but actually seeing what your options are as you're trying to find the information. And so here we have the Washington Post. This is, Washington Post is a well-known news organization. So I'm actually going to click on that. And that leads us to the very second thing that we want to talk about, which is something we call lateral reading. And why do we call this lateral reading? It's because we're opening up a new tab right next to our original tab, right? So we're trying to do a search. And once we do the search, we're actually going ahead and reading this article and this information. Now, in this case, we're trying to figure out whether this image is correct. And here's what seems to be the same image, but there's different text on it. So we can go back to our original image. This has this text on it, which seems like maybe it's a conspiracy theory. We go here and it's a different text. And one of the interesting things, again, by using our observation, we have a caption here, we have a description. We also have the name of the photographer and the name of the news organization that this person worked for. So we can do an additional search. When we looked at this original image, we didn't have any of that information. We didn't know who took the image, we didn't know where it was taken. But here, we actually do have that information, and we can then dig deeper if we want to. But to me, because this is the Washington Post, because it has more information, I'm more likely to think that this is actually the real image rather than this one. So just by taking a few moments, doing something like doing a quick reverse image search, and we can actually go onto Google as well, and we can go to images.google.com. And if we want to, we can upload an image. So if we take a screenshot, we can upload the image and we can do a search that way as well. So there are some ways that we can, by using some techniques, sometimes it's just by using our eyes and using our common sense. Sometimes we want to use some more detailed search like reverse image search. Sometimes we want to do a Google search. We can find more information about the thing that we have a question of. But what's important to remember is that it's really hard oftentimes for us to understand whether or not something is accurate, whether or not something is real, just by looking at it. So it's important for us sometimes to dig a little bit deeper. And to remember that, again, it's about engaging with information. This is what people who create misinformation do not want us to do. They don't want us to ask questions. They don't want us to open a new tab in our browser. They don't want us to ask a colleague or a trusted member or a trusted leader of our community. And I think that many of the people on this call are trusted leaders. So we want you to have those resources yourself to be able to hopefully answer those questions that members of your community are coming to you with. And one of the things that we will talk about, I just want to highlight that there are some fact-checking resources that are available. We're actually going to be sending a resource packet to everyone who's registered, which will have links to all of these resources. But these are some things that we can talk about, that you can talk about, and these are resources that you can share with your community as well. So now that we've finished that, and just before we move on to our conversation, we are going to ask you to fill out the second part of our survey. And this will, again, help us measure, hopefully, some of the impact that we've had. So if you could take just a few minutes, we're just going to pause for 2 or 3 minutes to allow you to fill out the survey. And then you will have an opportunity to enter your information separately to fill out the second part of our survey. And we will drop that, as you can see, there it is, hyperlinked. Drop that into the chat, and you can just go ahead and fill that out. And we'll be coming back to discussion and get your questions ready as well, because we want you to have an opportunity to, if there's anything we discuss that you'd like us to talk more about or questions you have, we have a wonderful native doctor who's going to be shedding some light on her experience with serving her community, as well as Dr. Payment as a tribal leader. So we'll be right back with you in 2 or 3 minutes. All right. So as we hopefully you've had a chance to fill out the survey. If you are still in the process of filling out the survey, no worries. You can continue to do that as we move on to the next part of our conversation. And if you have had a chance to fill out the survey, you can click the link in the chat or type in this link here, and you will be able to enter your information to win one of 5 $100 gift cards. So feel free to enter that raffle. But now I want to stop sharing my screen. And I want to welcome Dr. Aaron Payment, who is the recording secretary of the National Congress of American Indians Executive Board and is serving his 4th term as chairperson of the Sault Ste. Marie tribe of Chippewa Indians. That with more than 46,000 tribal citizens, his tribe is the largest east of the Mississippi. He has served as a tribal council member, a vice chairperson on numerous national level tribal advisories, and has dedicated his life to upholding the treaty and trust obligation and advancing opportunity for American Indians. Welcome, Dr. Payment, and thank you so much for joining us.
Thank you. Can you hear me?
Yes, I can.
All right. I learned a few things in the presentation about especially click fatigue. So I wanted to just say a couple things. So I am from a very large tribe. I'm an American Indian. I grew up near a reservation. We didn't have a reservation when I grew up. And one thing I have in common with with our doctor that's going to join us in a minute is my house was 20 by 21. So I've got you beat by about 3 or 4 square feet. And I grew up without indoor plumbing. We had an outhouse in my neighborhood as well. And so in the wintertime, you did not take your time in the bathroom. Let me say that. All right. But what I wanted to say as an American Indian is, we're subject to the misinformation cycles, and we call it the moccasin telegraph. I claim I'm a conspiracy enthusiast, right? I'm an American Indian. And we've had lots of experiences over history with why we would distrust government. And, the trail of broken treaties, the trail of broken promises, at the hands of the federal government, the Indian boarding school experience is something we're learning about. Other people are learning about right now that we already know about. Removal, reservation policy, the introduction of smallpox and blankets to purposely eradicate our people to get out of the treaty and trust obligation. So if anybody is suspect of the federal government, and then by transition our own government, because we have our own people that are distrustful of our own government, it's American Indian people. And so also I wanted to share, we live in pockets of society very similar to the people that live near us. We're not monolithic as a people. We're very similar to the people we live among and near. And I live in a rural community. I live in a community that is mostly a red community with people who believe in conspiracy theories and some of the right-wing stuff that's pushed out. But not all of our people believe that way. And so it is a challenge for us to try to push out information and to get people to become critical consumers of information so that they can discern through this on their own and check and do their own fact checking. I'm really surprised about how little of that's actually being done in society right now that people are taking as gospel because they see it. There used to be, if you saw it in the newspaper, it must be true. Then it became, if you see it on the internet, it must be true. Now it's if you see it on Facebook or Instagram or whatever those platforms, it must be true. But I do want to say with respect to the vaccine real quick, is I do serve on the National Institutes of Health Travel Advisory and HHS Secretary Travel Advisory. And I was consulted as a tribal leader and pushed hard that during the testing that we oversampled in Indian country so that we knew this vaccination would be safe. And they did. The oversampling means because we have a very small population, in order for it to be statistically significant, you have to sample more American Indians than you otherwise would sample, so that the results on the other end, there's less error rate, and they did do that. And I want to also just say real quickly on this phenomena of disinformation, we want to believe this is over. You know, we've been through difficult almost 2 years. We want to believe it's over. We want to get back to normal. We have vaccination fatigue, and we even have members of my council who have proposed to revoke the authority of our medical director, our public health director, who's trying to keep us safe and alive. And so those politics exist in Indian country, but I just encourage everybody to fact check, double check, double check, double check, and don't take information as gospel. It seems like with the information world that we would be better consumers of information because we have so much more available and we can go look it up. But unfortunately, people want a quick response, they want a quick answer, and it seems like we're dumbing down a little bit, and we should be more critical. And I don't mean education-wise, everybody can be critical consumers of information, so we just have to double check what we're reading. And with that, I get to do the introduction. And so now it's my honor to introduce Dr. Saban Westcott, who will join Damaso in our conversation and our audience answering our questions. Dr. Saban Westcott is the University of Nebraska Medical Center's newly endowed professor and director of American Indian Health Department in the College of Public Health. Dr. Westcott earned her degree in government from Dartmouth College and then went on to earn her master's degree in public health from the University of California. Dr. Westcott received her medical degree from Harvard Medical School. The new Dr. Susan and Suzette Lefreche professor was most recently the co-director of the Indians into Medicine program at the University of North Dakota. An Alaskan, Dr. Westcott grew up just outside of Fairbanks in a tiny 400 square foot cabin with an outhouse. Dr. Westcott has always been a staunch advocate for Alaska Natives and American Indians, especially when it comes to issues of health equity and educating the next generation. She's cultivated a nationally recognized voice, especially through her work with the American Medical Association. So welcome, Saban, and thank you, Dr. Westcott.
Thank you. It's great to be here and to hear everyone's questions. I don't know if do we have questions yet, or should we?
Yeah, let's just dive right in. Dr. Westcott, in your practice, what are some of the common concerns that that your patients are bringing to you around the vaccine, and how do you talk to them about it?
Okay. Well, first I have to say I'm a public health physician, so I work at a university. I don't see patients directly, but I'm trying to affect many patients than could be seen in a day. Right. So a lot of what I've heard, though, concerns about the vaccines is that it's just too good to be true. We've desperately needed a vaccine or some way to fight this terrifying disease, and then all of a sudden it was there and it seemed too soon. So I think a lot of what I hear is just people are like, well, there's got to be something wrong with it. It can't be this good. It's too good to be true. And I had some of the same concerns, just the pace at how quickly the vaccines got created and tested. But I did ask around, and being a physician, most of my friends are physicians of color. So I worked my network, and it turns out that normally vaccine trials take years because people don't want to sign up for them. And it takes a while for people to catch the disease. So usually it takes years because you have slow enrollment, and then it takes a while to reach a set number of cases so you can really see if the vaccine worked or not. So with the pandemic, people were signing up left and right, and they got their recruitment goals done very quickly. And then because early on, this was all happening last year in 2020, America did so poorly at controlling the pandemic that we got cases very quickly. So I understand people's hesitancy and just looking for any problem because it seems like too good to be true. However, it's just because the stakes were so high, people signed up, people got the disease in the trial so that we were able to figure out that these vaccines actually are safe and effective.
Great point that you bring up. A lot of people do have concerns with how quickly the vaccine was developed. These are the fastest vaccines to ever come to market. And, back in, summer of 2020, we were hoping and praying that we would get a vaccine, although many of us didn't expect it. And here we are with a vaccine. But it's important to note that the technology behind the vaccines has been developed more than a decade ago. And to your point, we're actually able to enroll lots of people into the vaccine trials because, unfortunately, because COVID was spreading so quickly, we're actually able to finish the trials because we were able to get a large enough sample of people who had gotten the vaccine, gotten COVID, to realize, whether or not the vaccine was effective. So while it was developed relatively quickly, that's actually a blessing. That's actually a good thing. And it actually speaks to the real challenging situation that we were facing. Dr. Payne, within your community, what have you encountered in terms of hesitancy? I think one thing that is important to acknowledge is that many Native American communities are actually very highly vaccinated. In some cases, more highly vaccinated than the communities around them. So that's a very, very good thing. But we're at that stage of vaccination where we're trying to reach the hardest to reach, the people who are maybe the most concerned or the most hesitant. So when you encounter those folks, what are you hearing from them, and how are you engaging with them? Oh,
You're on mute.
You're muted.
Okay, first let me correct a false positive. And the data reporting, and I'm a stickler for this, I'm a quantitative researcher. The data reporting on the high vaccination rate is a misnomer, because the information that is reported is based on our service area population. The Indian Health Service provides funding for our purchase and referred service areas. So my tribe is Michigan, 1/3 are in the Upper Peninsula, 1/3 in Lower Michigan, and 1/3 across the country. The service area is only a part of the Upper Peninsula. So we do have about a 40% vaccination rate or higher in our service area, but we don't have any data. And the federal government doesn't have any data for the population of American Indians who don't live in that service area, that service delivery area. And so I would say, because the further away from our service area you are, the less resources you have access to, it's probably much, much worse. It's probably much lower for our people. And if they don't have health insurance, it's probably even lower if they're not seeing a physician on a regular basis. I would say one of the really weird phenomena of this, and it's explained because American Indians are suspicious of government. We have reason to be. That's the experience we have. And because of that, we have fear that somehow the federal government is targeted through this vaccination to go and annihilate American Indians. And that's a very real conversation that's happening in Indian country. And what I try to tell people is we're getting the same vaccination as everybody else. And they say, well, it's coming through Indian Health Service. And I'm like, okay. No, it's not happening for real. It's not happening. But the other thing that's really weird to me, what I'm finding is some of the people that are suffering from the opiate epidemic that is prevalent both before and after and exacerbated through the pandemic. These are people who are skeptical of the vaccination, yet are using drugs, and basically, because this is an illegal drug trade, there's no quality control on the use of those drugs that they're taking. And it's puzzling to me. And it's really kind of like it's a government resistant sort of thing, that it's easy for people to look to find a reason to justify what they already believe. I don't want government intrusion in my life. The government shouldn't be telling me not to use the illegal drugs. That's none of their business, blah, blah, blah. They shouldn't tell me to have to be vaccinated. So I think it's like a continuum sort of thing. And so we have to do our best to promote that it is not a targeted ethnic genocide effort, and that it's the same vaccination, and whether you're a rich person or you're somebody that lives on the res, it's the same vaccination, and the efficacy has been shown. And here's the other thing, a lot of people talk about the side effects and the fear of the side effects of vaccination. Well, the side effects of not being vaccinated, which is death, is a lot worse, or the complications from having COVID and the long-term effect of it is a lot worse than the effects of the vaccination.
And I think it's important for us to note that the vast majority of people who are dying now of COVID are people who are unvaccinated, even though there are breakthrough cases. And we've most notably seen that with former Secretary of State Colin Powell. And there are people who are double vaccinated who do die. When we look at the large numbers of people who are dying, the vast majority of those people are unvaccinated. So we know that vaccination is safe. And I know in my community of, go ahead,
I
Doctor.
could just comment. So Colin Powell is an excellent example because he had a form of cancer that is essentially a chronic disease, but it affects his immune system. So even though he was vaccinated, his immune system wasn't strong enough to be able to fight the virus. And that's why we need to be vaccinated. So people say, well, I don't need the vaccine. I mean, it didn't help Colin Powell. It's like, well, Colin Powell is exactly why we need to get vaccinated, even if you're not sick or you don't have risk factors, so that you don't catch it and unknowingly spread it to someone who can't fight it.
Can I add to that? So
yes,
if in our Indian, again, Indians aren't monolithic, so we have different beliefs, but a common belief we do have is that we're part of the spirit wheel and we're responsible for each other and we care about one another. Now, I'm also Christian, so my belief in Jesus Christ and also our caring for one another. If you believe that you don't need it, if there's a way for you to isolate yourself from society so you don't put other people at risk, if we do care about one another, then we should love one another and care about one another enough to not put somebody else at risk. So Colin Powell died because he came across somebody who spread the COVID to him, and he had a compromised immune system. And I'm not putting any blame or anything because things are accidental. But if we have this libertarian sort of view that I shouldn't have to be vaccinated, if you could totally isolate yourself and not put other people at risk, and if that's a choice you want to make for yourself, but that isn't the choice you're making for yourself. That's the choice you're making for your fellow man and woman in society. And that's a very selfish choice. And we should care about one another, not to put other people at risk.
Absolutely. I think that, one thing that's really important to recognize, whether we're talking about spreading COVID or we're talking about spreading misinformation, our actions have an impact on other people. And that's a really, really important thing that we need to recognize, is that we can help keep our elders safe. We can help keep the vulnerable people in our community safe by being responsible, by getting vaccinated, by not sharing misinformation. We have a couple of questions in the chat. And our second question, maybe Dr. Westcott or Dr. Payment can speak to this. Do any tribes calculate case fatality rate vaccinated compared to unvaccinated? So we know that many local and state governments and federal governments do this, but do any tribes calculate this?
I'm not aware of any, but it's also, they own their data, so they don't necessarily have to share it. What we do know from the general population in the US is that 90+%, I don't know what exactly it is today, of people who are dying currently are unvaccinated.
Yeah, I think that what I've heard through the pandemic is, well, what's the survival rate? Well, I'm not worried about the people who survive. I'm worried about the people who are dying. And it's a little bit of a talking point that and no offense to the person who posted it, but it's a talking point that's put out there because they then try to make false equivalence between how many people die of the flu or, and the thing is, I'm not worried about the people who don't die. I'm worried about the people who do die. And we don't calculate that information. We're in the thick of this, and I think post-mortem, when we look back at it, we'll probably want to analyze that kind of data, but we're still in the trajectory of this pandemic where we're trying to save people's lives.
Yeah, I think it's also important to recognize, while obviously our absolute first concern needs to be, preventing people from dying, there are cases of long COVID. There are cases of people having serious long-term side effects from getting COVID. So we know, because tens, if not hundreds of millions of doses have been given in the United States, if you're vaccinated, you're less likely to get COVID, you're less likely to get a serious case of COVID, you're less likely to die of COVID. And the side effects from the vaccine pale in comparison, as Dr. Payment mentioned, to the side effects of actually getting COVID. Even if you don't die, the side effects can be very, very serious and can impact your life. So we have the data. There's no way to parse the data that doesn't tell us that the vaccine is safe. It doesn't tell us that the vaccine is effective for every population, whether it's Native American or Black or white. One of the things I was going to mention earlier was early in the vaccination process, we saw people from wealthy zip codes and wealthy neighborhoods going to poor neighborhoods, especially in New York City, in their town cars, in their Ubers, to get vaccinated and then leaving. And to me, that was the best sign that this is a safe vaccine, because the only time you see these people coming to these areas was to get the vaccine because they couldn't get it in their area. So to me, that's an indication that yes, we should be getting vaccinated. It's certainly safe. We have another question.
Can I just add a thought?
Yes, please.
So just to speak to it, so I've been watching, the lighting goes in and out for me because I'm backlit, and I feel like that is a metaphor for Indians going dark about the information of the vaccine. I feel like we don't trust it. It can't be right. And it waxes and wanes. People sometimes are like, oh, maybe it's not that bad. Maybe I should get it. And then they go dark. And I do think, full disclosure. So I was living in North Dakota this winter, and I wasn't sure when I would be able to get the vaccine. So I ended up signing up as a patient at the Minneapolis Urban Health Center, and within a week they got me in to get my first dose. So it's a 10-hour round trip drive. I did this twice to get the vaccine, and I had lots of side effects, and I don't know if it's because of the vaccine or because I did a 10-hour drive and some power shopping while I was there. It's but I've taken this leap. That was more than 6 months ago. I'm still here. I never got COVID, and I feel protected. So, a lot of this discussion is here's some facts, and then there's bickering over whether the facts are really true or what's true today. I think from the heart, I took the leap. I'm so glad I did. I feel safe. I feel protected, and I want all of you to live and feel safe and feel protected. So if there's any final questions as to why you're worried about the vaccine, please let us know, or we'll find some way. If you have other questions, we'll find some way to answer them offline, because we want you to be safe. We want you to live. We want you to be protected and to protect others.
Can I add something? What's interesting again? So I originally was trained as a sociology, and then I have several degrees, but in public administration, and then education. So I think a lot about why do we think the way we do, and so I'm at that age. I was born in 1965. I'm at that age where I have a big scar on my arm from being vaccinated. Kids get vaccinated as a normal course in the public school systems. Unless you have a religious exception, you have to be vaccinated to go to public schools. This is something that has been generally accepted in society as kind of like, our social contract with being a member of society. And why this is such an issue today, rather than during polio vaccination or measles vaccinations, is because it's been highly politicized. It's been used and weaponized as a tool. And And so what's really maniacal about that is the misuse of that and preying on people. And, you know, and watching the data in red states and in red districts and the lower vaccination rate. And it wasn't until then that some commentators started promoting vaccination, because it's like, wait a minute, our voters are going to die. And, you know, what's weird in this phenomena is what we have come to know to be kind of a normal course in life, in public health, to be vaccinated, and is to make people fearful of it and the misinformation. And to me, that's a horrible misuse of the public sphere, is to make people fearful of the very thing that can save their lives, and the politics behind that, or to, you know, for our former president to have been vaccinated early on, but to have kept it secret and to not have put it out there, just because it didn't fit the narrative of the people that were supporting his campaign. You know, I just find that very manipulative of the public, and, you know, put all the information out and let us decide. But this should be normal. This should be the normal course for us to be vaccinated against that which can kill us.
Dr. Westcott, do you want to add anything before we wrap up?
Well, I'll just say, again, I understand that people have concerns. The federal government and the state of Alaska did some terrible things to my family. I understand why people are hesitant and afraid. But this is a win for public health. This is a win for American Indians and Alaska Natives. The vaccines are safe. They will save lives. And I want you to be around, because I'll tie this into, I think, what's going to come. And my mom went to boarding school and had her language beaten out of her. I mean, we all have those stories. I think of the graves the unmarked graves that they're finding now. That is generations of people that never existed because that child died at a boarding school in a horrific experience. And everybody that we're losing who was Native American from COVID is generations that will not exist. And so I think we need to keep that in mind when you're trying to decide what the right thing to do. And again, my bias is you should get vaccinated. I want you to live.
Yes, I think that's very well put. As we wrap up, I want to thank Dr. Payment and Dr. Westcott and the National Council of American Indians, as well as the Native American Journalists Association as well. Keep an eye out for a follow-up resource packet, which will have a lot more information, and so you can dive even deeper if you want to. Of course, please stay in touch with us at Penn American. Feel free to send us an email if you have any follow-up questions. We really appreciate your time, and we hope that this information is useful to you and useful to your community. And we hope that you stay safe and keep your community safe, because we know there are a lot of challenges for our respective communities out there, and we have some tools at our disposal which can help protect us in a world which is often very, very hostile to us. So please be informed, stay safe, and we hope to see you again soon. Take care. Thank you so much for joining us.
Thank you.
Thanks.